Hi everybody, this is Dr. Ken Muich, Fibromyalgia Wellness Center, and I welcome everybody here. If you have any questions, feel free to send them across and we'll get to them as soon as we can. Last week I begged off and did not do a presentation. Matter of fact, this is number 30 live videos. Each one of them I've actually saved on Facebook, so you can check back and see. Every one of the topics are on fibromyalgia or related fibromyalgia subjects, those things that I think might have an immediate effect or long-term effect on fibromyalgia patients. But last week I was in Chicago. I went to visit my brother, a little older than myself, and he has Parkinson's disease, and I spent some very, very valuable time with him. Very, very interesting. 2 years ago, when I saw him last, he still was quite, I thought, active. He was having some problems walking, but communication, everything else seemed to be just fine. But within 2 years, he has declined appreciably, where he's, for the most part now, wheelchair bound, getting in and out of wheelchair and getting in a car or any other communication or mobilization is very, very difficult for him, along with his speech and obviously hand motion and so forth, very, very difficult. So I had a chance to work with him a little bit and release some of the muscle tension, because Parkinson's patients do have a problem with that. The reason why I brought that out is that Parkinson's, even though it evolves and develops over a period of time, gets worse and worse. To me, it's very, very similar to ALS in some respects, in that like many ALS patients, his brain was pin sharp, extremely sharp to do a variety of different things, except his body would not allow him to do that. He's tried a variety of different treatments and so forth. He right now has a machine that is attached onto him so they could increase the medications that go directly into his abdomen. They did try the one into the brain, but that didn't seem to work. So the interesting thing about Parkinson's is that it's relatively easy to diagnose once the symptoms start. That is not true with fibromyalgia patients and many other conditions that have very similar symptoms of fibromyalgia. So what qualifies you as a fibromyalgia patient? Well, first of all, there's a lot of confusion, frustration amongst doctors. The diagnosis, differential diagnosis for fibromyalgia is always a problem for many doctors. Even rheumatologists have a difficult time because it mimics and works with so many other conditions. And so that can be a real problem. So how do you differentiate and find out if you have fibromyalgia from all the other conditions? Because they do mimic and match and cross over. Well, first of all, it's important that you write down all of your symptoms. Write all your symptoms down, literally from almost the time you were born, if you can remember back that far. Because a lot of patients come in and they say, I think I've had this all my life. But I was told, and I've mentioned this before to people on live video here, that yes, that is true. You do have symptoms that slowly evolve and develop, but many doctors just call them growing pains because they couldn't find anything wrong with you. And that is obviously true, because as you'll find out, that's one of the diagnostic problems. But write all your symptoms down from literally day one that you can recall and remember, whether it be aches and pains, whether it be inability to walk, fatigue, headaches. All those things are extremely important. Rashes, you name it. And all of those have a tendency to add up to fibromyalgia and differentiate themselves from many of the other conditions that we're going to talk about in a few moments. Some of this I've already covered, but it's very, very interesting. I get more and more fibromyalgia patients coming in, and they get very, very confused with all the other conditions that they have. And they've been treated for these other conditions rather than fibromyalgia. Another diagnostic aspect of fibromyalgia is the 18 points. What if I were to tell you, however, that many patients, maybe 40% of all the fibromyalgia patients that come in, don't have 11 out of the 18 points of tenderness or pain that they have on their body? That does not mean that they don't have fibromyalgia. It's just another one of those tricky things that cause fibromyalgia patients that cause them so much frustration, and also doctors. So what really differentiates and sets you off from many of the other conditions and so forth? Dr. St. Amand and I have worked on this for many years, and it's called mapping. Mapping is something that if you look on YouTube, as a matter of fact, I have a system on YouTube, just look under fibromyalgia and YouTube mapping, and I show you exactly how it's done. It's actually a mapping of your body to find fluid-filled areas, lumps and bumps, anything from pea size to marble or sometimes larger in your body. And what we do is we test you for this mapping, and that really differentiates you from just about any other condition you may have. However, to many doctors, especially by the time I see a patient, many times they've already gone to 3, 4, 5 different doctors. Maybe they're being treated by the same number of doctors or new ones. There's too many remedies, too many drugs, too many over-medicated patients, unrelenting pain, so forth. And what the doctors do is they concentrate not on the condition, but on the symptoms. Look, we got to take care of these symptoms. We got to knock these symptoms down, that joint pain and so forth, those headaches and this, so forth and so on. So they give patients all these different medications. And I mentioned before, patients come in with an 8.5 by 11 sheet of paper with all these medications on, of which many times they're for medications for conditions they don't even have, or unrelated symptoms, and each and every one of those are problematic. So along with the problems that you're having, you might want to write down what your symptoms were, like I say, from the beginning, as I mentioned. But then, what are your symptoms after you start taking medications? Do they cross over? Your headaches, are they worse? Are your rashes worse? Is your fatigue worse? Joint pain and so forth, are they worse? That's just some of the many symptoms. How about concentration? You know, the famous fibro fog. Does that make that much of a difference? Hi, Gail. Thank you for joining us. Really appreciate that. Don't be afraid to ask any questions. So, the problems that these medications actually add on to many of the symptoms that fibromyalgia patients have. So as I mentioned, what medications are you taking, and whether or not they differentiate. So there's something called diagnosis by elimination that doctors actually go by. Very, very interesting. They rule out all the other possibilities, taking all the different tests and so forth that you may have, and then what they do is they come to a diagnostic conclusion. The problem with that is that many of these other conditions oftentimes take a lot longer to diagnose than you might even think. Let's take, for example, irritable bowel syndrome, which is very, very common with fibromyalgia patients. Oftentimes it takes 6 months to diagnose IBS, and you have to have 3 days per month for at least 3 months where you actually have the symptoms that come up. Celiac disease, which is very, very common with fibromyalgia patients because of gluten sensitivity. And celiac is very difficult to diagnose. Many times it might take anywhere from 6 to 10 years. Let me give you an example. I have 3 adopted daughters. One of the daughters, I recognized almost from the beginning that she had a celiac problem and gluten sensitivity. But why listen to doctor or your dad when he might not know as much as the individual knows? So she went on and continued having problems until she finally one day passed out, hit her head, and ended up in an emergency room. And after the doctor talked to her, he said, "Hey, I think your dad is right." He says, "I think you have gluten sensitivity or celiac disease." Oh, my goodness. But when I took her shopping and showed her all the foods that she could have, and to stay away from those that just were causing the problem, all of a sudden it was like a light bulb that went on. Wow. And so she's been doing fantastic ever since. But the problem with that is sometimes it takes years to diagnose because it's so sneaky. Only half of the people, as a matter of fact, that have celiac disease have diarrhea or weight loss because of their condition, because they have other symptoms. How do these sound? How about headache? How about skin conditions, joint pain? All those things. That sounds like fibromyalgia, doesn't it? Yes, it does, but it's actually a separate condition in itself. as crazy as that sounds. Okay, so let's go through a couple others. RA, rheumatoid arthritis, and MS. They are very, very similar. Joint pain, so forth, fatigue, concentration problems, oftentimes headaches. But RA, of course, is a destructive disease, and so that is a destructive disease of the joints in itself. Hi, Natalie. Be with you in just a moment. MS is very, very interesting. That takes years to diagnose, and that has a problem because just like chronic fatigue, it has something called waxing and waning. It comes and goes, or you have mild conditions, then all of a sudden, boom, you have worse conditions, so forth and so on. And so oftentimes that can be, again, a problem for fibromyalgia because, again, the symptoms are very similar in reaction and so forth. You have osteoarthritis, which is the wear and tear type of condition or disease where you have additional bone as laid down in forms of lips and spurs, medically called syndesmophytes, or different things where you actually have calcific deposits form in between the joints, and that pinches many times the nerves in the tissue, causing pain. And so that can be all over your body, joint pain all over your body. You also have Lyme disease. Of course, that's a problem being bitten by a tick or a bug. Remove the stinger as soon as you can. That'll minimize certain things and get to a doctor as fast as you can for that. Lupus. That's very, very difficult to diagnose. Not everybody has that facial redness or skin condition, and so that can be very sneaky also in that respect. Hypothyroidism, hypoglycemia, all these things have similar symptoms with fibromyalgia, but keep in mind, like I said, keep a history of all of your symptoms. Check with the 18 points if you don't know what they are, check. Almost everybody has a listing of the 18 points. You don't have to push hard. Actually, if you have tenderness on light touch, that is a positive. That just goes to show you if you push even more, it'll be worse. But the key is the mapping aspect that we do, that doctors have to be trained on to treat you properly. Now, there are some massage therapists, physical therapists, so forth and so on, that we have actually trained in mapping. But that is a very, very important key that we deal with as far as fibromyalgia is concerned. So let's get to Natalie here in just a moment. I've only been diagnosed with fibromyalgia. I keep reading that it's a secondary diagnosis. So now I'm just waiting for the other shoe to drop. Is this true? Or is it possible to just have fibro? I've worked with fibromyalgia patients for almost 34 years now. And almost every, I hate to use all, every, and never, but almost every fibromyalgia patient has additional conditions, of which they can be sneaky. Could be osteoarthritis, could be something else, like I say. Maybe it's something you haven't even been diagnosed with. I have, with all honesty, not come across anyone that just has fibromyalgia. If you have fatigue as part of your symptoms, you probably have a mild form of chronic fatigue along with that. And I found that to be very, very true. Not all chronic fatigue patients have fibromyalgia, but almost all, I hate to use all, every, and never, but almost all fibro patients have some form of chronic fatigue syndrome involved with it. Most of it based upon your age or whatever else. You may very well have osteoarthritis of some form. Might be scoliosis. There might be a variety of different things, even low level. But we do know by research that fibromyalgia is triggered the vast majority of the time by some physical, emotional, or chemical trauma. And yet some people are born with symptomatology, and so again, all, every, and never don't fit into that area. Okay, so Gail, you said I've gone off my meds and don't need more symptoms along with fibro, and have learned, as being my own advocate, I'm in Canada and have yet to find a doctor to help me. I have many support groups. Great, that's super. Always say it's just fibro. How are we to know when there are hundreds of symptoms? That's the problem. You have to work with a doctor. Be honest with you, like myself or Dr. St. Ahmad, if you want to come down, get evaluated, so forth and so on. Fibromyalgia has dozens of symptoms, and that's the problem. Why doctors have such a problem diagnosing fibromyalgia, because as I just mentioned, it mimics 15, maybe at least 15 other conditions like MS and like RA, rheumatoid osteoarthritis and lupus and Lyme disease and hypothyroidism, hypoglycemia. I can go on and on. So all of those have similar symptoms. The problem with fibromyalgia, again, is that it is a non-diagnostic form of condition based upon allopaths. What I'm saying is allopaths diagnose fibromyalgia by objective tests, not symptomatology. The objective tests are blood chem, urinalysis, CBC, all the different x-rays, MRIs, all the different tests they run, and they all come back negative for fibro, except for those other conditions that they may have. Now, a lot of those tests don't show some of the other conditions. Osteoarthritis may not show up for years until it shows up in the form of an x-ray. You may have a disc problem, and that might not show up right away in the form of an MRI. So there's a variety of different things. Headaches. Headaches are kind of insidious. You can have those that are cluster headaches. You can have those that are migraines. Even migraines have different varying amounts of types of migraines. Some of them do not have the same symptomatology as migraines, and yet they are considered migraines. They're light or low level. I will say it's just fibro. How are we to know when there are 100 symptoms? I educated my doctor, and she had 40, 50 patients for which I recommended no fibro drugs and don't tell us to exercise. Wow, fantastic. I'm very happy to hear that. The AARP came out a few years ago with, and I'm not making fun of any medical group, but physical therapists did studies and they said exercise is the key. Excuse me? Exercise? You tell a fibromyalgia patient go exercise and they'll slap you in the face. They're lucky sometimes to get out of bed. They're lucky that they can actually function in a daily basis, and that might last for weeks before they can actually function. So yes, exercises is not the thing. Look, exercise for some patients is getting up and just getting out of bed. I mean, that's their exercise. They can't exercise. You know, I tried a variety of things over 30 plus years working with fibromyalgia patients. And a couple of things I found is, one, exercise is not good. I mean, I can stretch patients, I can work with their soft tissue and so forth, and chiropractic light adjustments and so forth. No manual adjustments on fibro patients. I have one patient that is a fibro patient that wants manual adjustments. That's it. Everybody else, we do what's called activator, very, very light adjustment. They hardly even know that it's being treated, and yet it moves bones very, very safely. So that is a real problem. Let's say, educated doctors. If we don't think there's a possibility that we've been exposed to ticks but still want to rule out Lyme disease, how do we go about getting tested? Okay, I'm pretty sure there is a blood test for Lyme disease. You might want to get that checked, although I think it's not 100% positive in its response, but that is one thing that you can get tested. But make sure you get to a doctor. Should there maybe is a rash that shows up, they can obviously do blood tests and so forth and find out if you've had it. But I believe, even though there is a restriction as far as the tick and the Lyme disease itself, I was just reading about that. The tests are not 100% positive. It's something that evolves over a period of time, like MS, like many other conditions. But keep in mind that the symptoms for fibromyalgia are much greater than just the Lyme disease in itself. And so you might want to check and find out how many symptoms you have, and if you've had it for 3 months continuous, and whether or not any medications, and you're not on medications. So are medications making a difference for you if you have to take them for Lyme disease? Oh my gosh, you understand. Thank you. Yeah, 33 years. Listen, I'm telling you. Thank you very much, Nellie and Gail. After 33 years, I haven't seen everything, but I'm telling you, I've seen almost everything come into my clinic with fibromyalgia and other secondary conditions. And the secondary conditions and the additional medications that you're taking, many times over-medicated, are causing just as many problems as many other things. Say, by the way, that there is very, very interesting, and I mentioned to you the last time I spoke, and that was a report from researchers that said that if you stay off of inflammatory foods, that'll make a big difference. And it does, believe me. Our pre-protocol involves taking patients off of sugar, gluten, trans fatty acids, and dairy. Not completely 100% of the time, just for about 2.5, 3 weeks while we detox the patients. See how you detox somebody properly? You take them off of a certain food for a couple of weeks, and then you have them add it. And if the symptoms recur, then that's not good. You got to stay off of that food. I'm sorry, but there are substitutes. There are different substitute foods. Hello, Gail, again. Let's see, I've done years of research with having fibromyalgia. I personally believe I was born with this horrible disease. Dr. Saint Amand, in his research with UCLA, found that you have a genetic marker in you that is triggered by some physical, emotional, chemical trauma or multiples thereof, or you're born with it and your symptoms start literally at the beginning, but they magnify as you have some other physical, emotional, or chemical traumas that evolve throughout your life. Let's say you get in an accident. I have a lot of patients that say, I was always kind of tired, fatigued, and achy and sore, but I really didn't have the big problems until I had that auto accident, or until I had that surgery, or until I got sick with really bad flu or one thing or another. Then all of a sudden, man, it just like went downhill. I got all these other conditions, some physical, emotional, chemical trauma. Chemical, molds and spores in your home might even be adversely affecting you. And there are different doctors that specialize in that. They can come and they can check and see if your home has any molds or spores and a thing like that in your home. So, as frustrating as it sounds, fibromyalgia, again, can be found with a number of symptoms, at least 3 months, should go all over your body. The symptoms are, I could be here until almost tomorrow explaining to you all of the different symptoms that you have, but they usually involve joint pain, fatigue, headaches, the rashes, oftentimes that, alopecia, hair loss. You can have a variety of different, like I say, skin problems. You can have irritable bowel, celiac, intestinal problems, obviously, and so the list goes on and on and on. So you can be born with it, as I mentioned. It evolves over a period of time, but is worsened by the things I had just mentioned. Gail says, yes, diet is important. I have 5 car accident, defiantly an X factor toward activating my symptoms. Oh, okay. Yeah, definitely an X factor. Yes. Take some soap and water and wash that big bullseye off the back end of your car if you've been hit that many times. I tell my patients that when they have multiple accidents over a short period of time. I'm so sorry to hear that, though. Really, just some people just have a lot of problems that show up and evolve. You can contact me directly at my clinic if you have any questions. My number is 480-948-4955. That's 480-948-4955. I give a lot of time to patients. I talk to you directly, and I can maybe glean information out, maybe from you, additional information to help you. We're going to have a training program for doctors, a seminar, October 6th and 7th in Scottsdale. And it's 12 certified educational units training doctors, not only in the history of fibromyalgia, goes all the way back to biblical times, believe it or not, but also our protocol, our total program, so that they can actually help patients where you are at. I don't know where you're at, but the key is to have a doctor that is trained in our protocol. We have between the two of us thousands of patients that are living normal lives, pain-free, if they stay on the protocol. I'm telling you, it works. It really does. Again, my number is 480-948-4955. Because of my schedule, we are open Tuesdays, Wednesdays, and Thursdays from 9 to 1 and 3 till 6 at least. And that's Tuesday, Wednesday, Thursday. If by chance you should call, you should be able to get somebody, except between 1 and 3 most of the time. We do take a break and go to lunch. But in the meantime, don't be afraid to call if you have any questions, concerns. I want to learn more about what we actually do to help our patients. And if you want to talk to some of the patients that have actually gone through our protocol, hey, it's open, I'm telling you. We don't have any secrets. Uh, and and yeah, that's and thank you, Gail, again. You are not crazy. You're not crazy. Uh, do you have patients that travel to you? I'm in Las Vegas and just to drive. Yeah, I've got patients that come from all over to help. And again, we're trying to get doctors in everybody's area so that we train them so that they can help you and minimize your travel. But again, you're not crazy. I got to tell the story if you have just a few moments. My goodness, I've taken way too much time, probably half hours going on. But it's important I answer all your questions. I was about ready to give up. I was working with fibromyalgia patients after I had testified in a court case, and about ready to give up. And then two things happened that changed my life and really has pointed me in a direction of working with fibromyalgia patients. One is I had the good fortune to meet Dr. Saint Aman, who actually I work with in his protocol. And the other thing is that in the year 2000, a big story in the newspaper where a young lady, 30 years of age, with family, was going from doctor to doctor and hospital to hospital to find out what was wrong with her. In frustration, the doctor started sending her away, not giving her medications, telling her that she was crazy. It was all in her head, and to go see psychiatrists. And then one day she made breakfast and lunch for the kids, and her husband sent them out. And then went out to our freeway out here and walked in front of a car and committed suicide. And in the letter she left behind said, "I'm not crazy, I'm in pain, and nobody seems to want to help me." And I was just heartbroken with the knowledge of the medical society turning its back on people like yourself that have fibromyalgia just because it doesn't fit into their training protocol as far as being able to understand the problems with patients. So we work and we do everything we can to help patients get back to the life that they want to live or that maybe they've never had. Anyway, I want to thank you so very much for your time. Again, any phone calls, 480-948-4955. If you get the message, I'm probably going to be with patients, so I'll get back to you as soon as I can. Thank you so very, very much. Really appreciate it, and look forward to talk to you next Monday again on another very exciting subject. Gail, Natalie, thank you so very, very much for your comments and questions. And we'll keep working to help you get doctors in your area unless you want to come down and visit. Thank you, thank you, thank you. Bye-bye now. Have a great week. Bye-bye.